Hello, everybody, and welcome to 3 o'clock with SOC. Give me just a moment so I can make sure folks that need Spanish interpretation can get access to our conference call line. Buenas tardes, muchísimas gracias por estar aquí con nosotros en otro foro comunitario 3 en punto con SOC. Como siempre, ustedes pueden escuchar este programa en español a través de una llamada de conferencia y el número que hay que marcar aparece aquí en la pantalla. Hay que marcar 646-749-3122 y luego hay que introducir la contraseña que es 779-328-221. We're super excited to have you all here with us today, and I just want to remind you that if you are ever not able to catch us at 3 o'clock on the dot, you can view these videos after the fact on our Facebook page and our YouTube page. The recorded English and Spanish versions will always appear on our YouTube and Facebook pages for you to access those interviews and information after these lives. I'm Gabe Charles. I'm the Civic Engagement Manager, and I've got a number of other SOC staff supporting me. Alan is on comments, and Marisol is producing. Very thankful to have them with me. I want to remind you all, too, that you can still get us whenever you need us. We are not working in person, but you can access us through phone, through email, or through our website. You can call us at 414-672-8090. You can email us at soc@socmilwaukee.org, or you can visit our website that has tons of information that we would provide to you through email or phone. If you just want to check out that website, it's socmilwaukee.org. I would love for some people that are watching today to fill out our SOC survey. It's just a feedback mechanism that we have to see what you think about the forum, get your ideas, learn about what topics you think would be interesting and important for us to have on this forum. It's likely that the format will change in the future, but we would love your input to know how that should be formatted. So now more than ever, it's really important that you fill out this survey so we can get your opinions on how to move forward with this resource that we have for all of you. At the end of the day, we do it for you. So please go ahead and fill out that survey. It does appear in the comment section. I did mention that we are still not doing any work in person, so that is why you don't see me with a mask on today. All SOC staff is still currently working virtually from home. So just know that if we were working from the office, we would absolutely be adhering to the mask mandate to ensure that we stay safe and all the people that we encounter stay safe. I would also love to see who's here with us today. So if anyone is watching, go ahead and give us a like, give us a heart, give us a hello, a comment. Let us know what you're excited to hear about today. We are going to be talking about something that's on a lot of people's minds today, talking about the COVID-19 vaccine. So let us know what you're excited to hear about or any questions that you have about it. And then also, I just want to provide a disclaimer that the views and opinions shared today do not necessarily reflect those of SOC. We are a certain kind of organization, so we just have to give that disclaimer, as we do want to make sure that our guests always have the ability to share their full voice and opinion. So as you can see, it is not Marlene with you all today. I am filling in for Marlene as she takes a well-deserved vacation, but today is COVID-19 Day. And we're really excited to have some awesome guests with us today. We have Claire Evers with us, who's the Deputy Commissioner of Environmental Health. And we also have Dr. Heather Paradis, who is Deputy Commissioner of Medical Services and the Chief Medical Officer from the Milwaukee Health Department. So we're going to get some updates on COVID-19 in Milwaukee and learn a little bit about how the vaccine will be distributed in Milwaukee. Tomorrow, we also have a really cool guest. We're going to have Pedro Hernandez with us, who is an attorney at Legal Aid Society. He's going to be talking about how you can be represented if you're facing eviction. And then also, we just want to remind everybody that starting on Monday, December 21st, we're going to just start replaying some of the forums that we've had in the past that were the most popular. So the ones that got the most views, the interviews of guests that people really loved and enjoyed watching. So as staff takes a break during that time, you will still get some access to some cool interviews and information from different guests that we've had throughout this over, I think we're past 175 episodes now. So if you are looking forward to that, go ahead and give us a like or a heart as well. But let's go ahead and see if anyone has said hi already. Let's see if I'm lonely here. It looks like I am. So if you're watching, go ahead and give us a hello. But with that, and as we wait for any hellos or comments, let's go ahead and bring on Claire Evers to start, who will give us a quick update about numbers in Milwaukee regarding COVID. Hello.
Hello.
So glad you could be on with us today.
Yeah, thanks for having me. Happy to be here.
Yeah, so why don't you go right into it and give us an update on what's going on in Milwaukee.
So I actually have some good news today, which is something that I haven't had in quite a while. So we have had a change in our indicators. So as everyone knows, we follow our Moving Milwaukee Forward Safely orders, and that includes gating criteria. So our cases indicator went to green today. So that means that there has been, there's a couple ways it can go to green. The reason it went to green is because we have seen a negative trend in our positive cases. Our positivity rate is still over 10. I believe it is at around 11%. So that still is pretty high. It's not good, but we are seeing a good trend. So I'm happy people are probably listening to our advice and our guidance on limiting gathering with families over the holidays. And so that's a good thing. Our testing indicator is still at red. That is our only red gating criteria at this time. And that is because we are over 10% positivity. So we still are seeing too many positive cases in our community to say that we have a good handle on the pandemic, on the virus. So that is still at red. Our care indicator, which is the indicator that lets us know how our hospitals are doing, that is at yellow. That means that 10 to 20% of the hospital patients in our area, and that is all of Milwaukee County, not just the city of Milwaukee, we have 10 to 20% of hospital patients that are COVID positive. And then our safety metric, which is related to PPE availability in our hospitals, is at yellow, which is the middle category. And that means that the hospitals have about 8 to 28 days of all PPE supply for majority of the hospitals. And then finally, our tracing metric, which means our contact tracing, that remains at yellow, which means that is our middle category. And that means that 50 to 95% of the COVID positive residents are reached within 2 days after case assignment. So some good news also as it relates to contact tracing is, if you remember several weeks ago, I mentioned that we were at crisis standards for contact tracing, meaning that the burden was so high and the case numbers were so high that our staff could only contact the individual who was positive. However, they now are getting to a point where the cases are going down to the point that they can now contact contacts. So we are going back to our regular standards for contact tracing. And that is so important in responding to this pandemic, to be able to notify people if they have been in contact with somebody who's COVID positive. And then I believe I also have information here for some specifics related to zip codes and demographics. This information is about a week old. I didn't get the update yet today, but it's still really good information for us to have. So as it relates to demographics, we want to remember that COVID, it's highly contagious and it affects all areas of our city. It's still really important, even as vaccine is rolling out, that individuals follow social distancing and hygiene guidelines in order to slow the spread and the rate of infection. Our African-American population has been impacted heavily by the virus, comprising 29.4% of COVID-19 cases in the city of Milwaukee. The zip code that has been most affected is our 53215 zip code on the south side. A total of 7,917 confirmed cases have been identified in the 53215 zip code. The neighboring zip codes, 53204 and 53221, have the second and third number of highest cases. Our Hispanic population has been the most heavily impacted by COVID since it was first observed in the city. So that population accounts for about 29.4% of all confirmed cases in Milwaukee. There's been a total of 14,441 confirmed cases in our Hispanic community, and this is more than the cases in our African-American population. There's been a decrease in new cases, and that has been relatively slow in the Hispanic population. let me see, scrolling back down a little bit. So our age group of 65 plus is the most vulnerable, and that makes up 9% of the confirmed cases in the city. The age group that's most affected is still our 25 to 34-year-old age group. So that's 22.2% of our cases. And then the second highest age group is our 15 to 24-year-old age group, which has the second highest, which is 20.5. So it's really positive that our most vulnerable population is not our group that has the most amount of cases. We're still seeing that in our younger population. And that is what I have for you today.
Thank you so much for all of that information. You always give us such vital things to think about and to, at least in this case, be a little excited about. We still got a long way to go, but it's good to see that things are trending in a more positive direction.
Yeah, one thing we don't want to see, I just want to do this little plug. So what we see here is we're seeing a good trend in cases, and I think it's because we had such strong communication about, making sure you don't gather during the holidays, make sure you're wearing a mask, make sure you're maintaining your social distancing. We don't want people to get complacent seeing these good numbers and getting really excited. I was like, oh, maybe I can go on vacation soon or something. You don't want to get too excited yet, and we don't want to then see a big spike. So we want everyone to stay strong and stay committed to maintaining social distancing, keeping your hygiene in order, and wear your mask, and we'll get there. And so we're seeing some positive trends, and we just want to keep that going.
Absolutely. Well, thank you so much for being with us, and we look forward to a future update, hopefully with more positive information as well.
Thank you.
All right, and now we will bring on Heather Paradis to talk about the COVID-19 vaccine and what that's looking like in Milwaukee. Hello, thank you so much for being with us.
Thank you.
So to start out, why don't you just introduce yourself? This is the first time you've been on with us, so we would love to know a little bit about you, and then just talk about your role with the health department.
Absolutely. So my name's Heather Paradis. I am a pediatrician and public health professional. I have the great opportunity to have been chosen to start as medical director at the City of Milwaukee Health Department starting this April. And so, as you can imagine, have been very heavily engaged with our COVID response. And I also do get to continue to practice pediatrics at one of the Children's Hospital primary care clinics in the Midtown location, a day a week. So gets to keep me my hand in clinical medicine as well.
Awesome. And I am so sorry for mispronouncing your last name. Thank you for saying how it's actually said. But yeah, so let's just give people an idea. How many vaccines does Milwaukee have right now?
So what we understand is this is a rapidly changing situation and very fluid. We do know that there have been several shipments that have been made to Milwaukee. I believe that the state at this point has received approximately 5,000, maybe a bit more doses of vaccine. I don't know how many of those were allocated to Milwaukee specifically, but that by the end of this week or next, they're expecting 50,000 to come.
Oh, wow. That's really great. And how many doses are required for the COVID-19 vaccine?
So the current vaccine that has been approved and is starting to be distributed, made by the Pfizer company, is a 2-dose vaccine series. And that is very similar to the vaccine that is currently under approval and likely to be approved today, the Moderna vaccine. They use the same technology for the vaccines, and so each of those is a 2-dose vaccine series.
Okay. And what are the phases of the vaccine distribution?
So the ACIP, the governing body that makes these recommendations for how and in what phases we should be distributing vaccine, has given some overall overarching recommendations, and they suggest that the first wave of vaccine, as we have seen, go to healthcare providers, specifically those who are on the front lines providing care in our hospitals, in our clinics, and in the community. They also allocate to that first phase individuals who reside and work in long-term care facilities. So in nursing homes, skilled nursing facilities, places that are housing individuals who are usually older and may have medical comorbidities or conditions, because certainly we've seen across the country the deaths that have occurred from outbreaks in those settings. The next phase of vaccine distribution is intended to be for essential workers. And the definition of essential workers is based on the definition that Homeland Security gives, and it's a fairly broad definition. So it includes first responders, fire, police, paramedics. It includes individuals that help maintain our support structures as a society. So individuals who deal with power, electricity, water, transportation, essential services such as groceries and housing, etc. So that category, as I said, is fairly broad and all-encompassing. And then finally, the last phase of what's considered phase 1 allocation will begin to provide vaccination to individuals who are 65 and older and may have medical comorbidities.
So that's phase 1, and then moving on from phase 1 would be a number of other phases as well. Do you mind
Correct.
going into those as well?
So after phase 1 is complete, we will start to move into individuals who may have medical conditions but might not be 65 or older, and then finally to the general population and general public.
Okay, and any idea of the months that this might be happening, or is it just based, it might be, I mean, of course it will be fluid depending on how people actually get access to the vaccine, but do you have an idea of when each phase might take place?
So we are anticipating that phase 1A will be, which is starting right now, will happen through the month of January and maybe into February. And at that point in time, we'll be ready to move into phase 1B, so the essential workers. We anticipate that maybe by later springtime, we will be moving into phase 1C, or early spring, I guess, and then moving on from there.
Okay, that's really great to know. And then who can get the vaccine, and maybe more so who shouldn't maybe think about getting the vaccine?
So the two vaccines that are, well, the one vaccine that is on market right now and the other that is coming, the Pfizer vaccine is for individuals 16 and older, and the Moderna will be for 18 and above. So of note, there are not going to be pediatric populations that are going to be vaccinated with either of these vaccines right now.
Okay.
There is also, studies have not yet been done with women who may be pregnant. And so although it is not to say that women who are pregnant cannot have the vaccine, because certainly we know that getting COVID during pregnancy is at risk for complications. Because of that, it just needs to be informed, that a decision making that you probably would want to have with your provider.
Absolutely. And then what about people that may have allergies? Are you giving any recommendation for those who may already suffer allergies or have to carry an EpiPen or anything like that?
Yeah, that's a great question. I have not seen the actual consent form yet because we have not yet received a vaccine, and with it will come the actual informed consent that individuals will be given. Generally speaking, similar to some of the other vaccines that do carry some precautions for individuals with severe allergic reactions, I anticipate this will be fairly similar, and it will be a very few individuals that can't or shouldn't, or should receive the vaccine maybe under differently supervised conditions. So we always carry emergency medications and the ability to respond to an emergency should it happen. But individuals who know that they have allergies might want to make sure that they get it in a physician's office.
Definitely. And then where might somebody get the vaccine? Are there going to be any hubs, or will it have to be with people's primary care physicians, or how will that look?
So I think it will be both. There are lots of individuals that have applied to be vaccinators. So certainly healthcare systems, offices, community health centers, public health has applied to be a vaccinator, and we do anticipate offering vaccine to the public when we're to those phases. And we also have many pharmacies, similar to the way they give other vaccines today, who have applied to be vaccinators for COVID.
That's great. We're excited to hear that there will be multiple options for people. And then is distribution going to be emphasized in those zip codes that have had a lot of spiking? And so you mentioned, or Claire mentioned earlier, 53215 and 53204.
Yes. So we do really want to stress getting the vaccine to those areas that have seen the greatest burden of disease.
Okay, cool. And then how many healthcare workers need to be vaccinated in Milwaukee? Do you all have that information of how many healthcare workers there are?
So I have heard that there are estimated to be about 450,000 healthcare workers statewide. If you take that Milwaukee has approximately an eighth of the population of the state, that would be around 50,000 individuals.
Okay. Great to know that then we'll soon have 50,000 doses coming.
Yes, yes.
And then should you get the vaccine even if you have had COVID in the past?
That is a good question. And I have not yet seen specific guidance from the CDC to that. I think that that is an area where we're still learning. We're still gathering data and information. We know that there is some period of time where individuals do have antibodies after having COVID illness. And the CDC right now considers sort of a 90-day window before they would consider somebody to have the potential to become reinfected with COVID. We don't have the long-term or big population-based data with respect to vaccine. What we know is that vaccine helps to prevent severe illness and hospitalization and complications for individuals who may encounter COVID. What we don't know is some of that longer term lasting effect.
Okay. And then would there be a way for healthcare workers to keep track of those who have gotten vaccinated?
So for Wisconsinites, all of the COVID vaccine information will be entered into our statewide electronic database for vaccinations called the WIR, the Wisconsin Immunization Registry. So that will track vaccination status.
Excellent. And then just a few more questions here. And I do want to remind people that might be watching, you can absolutely ask questions if you're curious about anything to do with the COVID-19 vaccine. We would love to see any of your questions or comments in the comment section. And then will you recommend that people continue wearing masks even if they get the vaccine?
Absolutely. It is going to be a while until we are able to lift those restrictions. So wearing a mask, washing your hands frequently, and keeping your physical distance from others are going to be really important to continue to do probably for all of 2021 and into 2022. It's really going to take, estimates are 70% of our population to have immunity before we can start to really think about relaxing some of that.
Yeah, that's definitely important for people to hear. This vaccine will, and it's also not guaranteed. Well, there isn't enough data still to know if, even if you can't get sick, they don't know if you're still capable of spreading it. So making sure you continue to wear that mask is going to be of utmost importance, and continuing to do the other things you mentioned. I had a dog with me the other day doing a forum, so I'm loving the barks in the background. Don't worry at all about it.
Thanks.
And then finally, is there a cost for the vaccines? How is pricing going to work?
So the vaccine supply that we are receiving right now has been subsidized by the federal government. So it is being provided at no cost through what is called Operation Warp Speed. That is the monies that the government has given for development and production of the vaccine.
That is really great and vital information for people to know, that it will be provided at no cost for them. Well, that is all of the questions I have for you. Thank you so much for sharing all of that. I know this is going to be a pretty unpredictable time for folks, but it's really important that we have people like you on to give us the facts and to just give us updates about what's going on. I did look in the comment section. It doesn't look like we have any additional comments. You were really thorough in all of your explanations, so we appreciate that. Is there any last message you want to give to folks before you head out for the day and our time comes to an end?
Well, I think that this is an exciting time, and we have seen a number of individuals who are happy to share their vaccination experience, as well as, not only what it was like to get the vaccine, but what it's like the day or two afterwards. And I think this gives a lot of hope and promise to us in helping to fight this virus. There will be many more announcements to come as other clinics and health centers, et cetera, receive the vaccine. So it will be an exciting time.
Definitely. We have Marlene. She popped on to say hello, and then she also said thank you so much for being on. So from all of us here at SOC, thanks for taking time out of your day to give us this information, and more importantly, to give it to our residents that are watching.
Yes, thank you.
All right, we'll talk soon. Bye-bye. Super grateful to have had that information from the Public Health Department, from both Claire and Heather today. And we look forward to hearing more updates from them in the future as the distribution of the vaccine continues and COVID numbers change and transform in the city. So with that, I will then share another update that Marlene provided for us that will get shared now.
Hi, my name's Peyton and I'm 19 years old. I live alone on the UWM campus, but I'm doing school virtually right now. I contracted COVID-19 about 2 weeks ago. I am not aware of how I contracted COVID-19 because the only places I really go are to work in the grocery store. My symptoms first started off with a sore throat, and I thought I had strep throat. I got tested for COVID and strep, but tested negative for both. The doctor put me on an antibiotic anyway, but after still feeling sick days after, I was recommended to get tested again, and that is when I tested positive for COVID-19. The doctor said that there are a lot of false negatives because so many people get tested too soon for COVID-19. My symptoms included a cold, sore throat, and for 3 days I had a fever of 102. I also lost my sense of taste and smell. But essentially, COVID-19 sometimes is not activated in the system until a few days after exposure. The correct timeline when exposed to COVID-19 is that you should get tested once, and if negative, you should quarantine for 3 to 4 days and then get tested again. This reassures your COVID-19 status. During my 14-day quarantine process, I stayed home for all of the 14 days. I filled my time with school, FaceTiming friends, cleaning my apartment, and mostly getting rest. I would order my food through delivery companies and had one of my friends bring groceries to my apartment door. Mentally, it was very exhausting and I was lonely having to be by myself for the 14 days. I would suggest that you schedule some Zoom calls with friends and remember to do self-care during this time. Also, fill your time watching movies and shows even though you're feeling sick within the 14-day period. Now that I'm done with my quarantine, after having COVID, I still have a loss of smell and taste. Not sure when this will come back. I'm lucky to have this as my side effect of COVID because one of my friends, about 20 days after quarantining, developed a rash on her face and was told it was from an after symptom of COVID-19.
Always important to hear testimony from people that have had it and what it was like for them. So thankful that Peyton gave us that testimony, and definitely agree with the message that was shared at the end that we shouldn't be shaming people for having it, and more so just focus on our own behavior and making sure we're not putting others at risk. And for my sorry, it looks like we're getting some comments that the video skipped through fast. So sorry if that was not what it didn't look okay for all of you on your end. We'll have to check what happened there. But for my civic update, I'm just going to give you all an update of what's happening in Congress right now. The COVID relief deal is being discussed and debated right now in Congress. But what we do know right now is that it will include a stimulus check similar to what we got at the beginning of the pandemic. It will be at least $600 a person, hopefully in these next hours or days that it continues to be discussed, that will get risen, because we know 600 isn't enough to cover the losses that people have experienced during this time. It will also include expanded and enhanced unemployment benefits, small business loans for those small businesses that have been struggling. It will also provide rental assistance, and then also include vaccine distribution funds. What it will not include is liability protection for businesses. So what that might mean is that if an employee contracted COVID at a company or at a business, those companies are not protected under this bill. And then it also does not include, unfortunately, state and local funding. So funding directly to state and local governments. So yeah, as that it could be finished, the debates and the deal could come to completion by today, but it will likely be completed over the weekend. So we will have updates for you on that relief bill as they come out. And next, I just want to share a video that Maria prepared for us that talks with Deanne, and so we can share that now.
Hi everyone. So today for our SOC feature, we will be having Deanne with us. Welcome, Deanne.
Nice to be here. Thank you for inviting me.
So Deanne is from Inner Beauty. Deanne, can you tell me a little bit about yourself and then your role with Inner Beauty?
So I am the executive director and founder of Inner Beauty Center. So I oversee the activities of the drop-in center and outreach, and then we do have a client advocacy program. So, pardon me. And then work on the administrative aspect of Inner Beauty Center. So we've been around starting our 9th year in September.
Okay. Yeah. Could you expand a little bit and tell us a little bit more about Inner Beauty, how it got started?
Sure. So in 2012, my husband was pastoring at a church on 15th and Lincoln. We'd been there for 12 years at that point. And it was actually the year before, 2011, a woman came into our church, and she was someone who was working the streets, who was addicted. We had a significant issue with women standing on our church steps to work, it provided a really good spot. It was by a bus stop and overhang and a light and all this kind of stuff. Anyway, when she came in, she said to me, God told me if I came in here, you would help me. And initially, my thought was, well, yeah, you're a drug addict and we're a church, which wasn't a very nice way of thinking, I do admit. But once she told me her story, I knew this was a woman who was in desperate need of help. So we did help her. Her story was that she was deceived by a friend, brought to Milwaukee from another state. She was brought into an apartment that was about a half a block north of our church. And there when she walked in, there were about 6 women sitting on the floor being treated like animals. And she knew that this was not a good situation. I don't know how long she was actually in Milwaukee, but we were able to help her. We were able to help her return to her home state by connecting her with her family, and they made arrangements to bring her back. But it took about another year before I realized that she was a human trafficking victim. I didn't understand that term. I knew about gun trafficking and drug trafficking, but not about human trafficking. And so from there started this, we've got to do something. And that's when, through some meetings with other churches and other interested parties, we started Interview Center.
Wow, that's such a great story. Usually we don't hear stories that insightful, so it's great to hear that. Can you tell us a little bit about what does inner beauty look like typically? So I know that things have changed due to COVID, but what did it look like before COVID hit?
So before COVID, our drop-in center was open 3 days a week. That was Tuesday, Wednesday, Thursday. And we had about 4 hours that we were open for women to come in and they could get a meal. And we have a clothing boutique and personal care items. And then we also had a beautician that would come in maybe once a week and provide free haircuts. And street outreach, we were going out maybe 2 to 3 times a week, depending on just how the schedules worked out. So once COVID hit, we actually shut down for about 6 weeks. And then we gradually resumed street outreach. Once we did that, we realized that a number of resources that the women would otherwise have were not available any longer. Some of the meal programs had shut down. Some of the outreach groups had to temporarily stop because of COVID exposure. And so to accommodate that, knowing that we couldn't open our drop-in center just yet, we increased our street outreach. And so Monday, Wednesday, and Friday, we're out on the streets for about 2 hours, either mid-afternoon or early evening. And then Tuesdays for about an hour, just before the drop-in center opened. So when we weren't open, they were out for about 2 hours on Tuesdays. We, at this point now, since we have reopened the drop-in center, we provide a bag lunch Monday, Wednesday, and Friday. And then just on Tuesdays before we open, it's just a reminder to say, hey, come on in. And so there's been a bit of change. We no longer have our sleep area. We no longer have a beautician that comes in. We have to limit access to the clothing boutique by allowing just one person in at a time. And then we try to limit the amount of time so that everybody has an opportunity to go in. So it has put a strain on just how we do things. All women are tested when their temperatures are checked and they're screened. And then when they go into the clothing boutique, they have to glove and mask. When they're in the center, they have to mask unless they're eating. And so we try to spread everybody out a little bit. We're kind of confined. We're not a big area. And so so we try to, stagger where everybody is sitting so that they can still enjoy their meal. But some of the areas that are really missed is the rest area, the cots, the sleeping area, that's shut down. And then not having the beautician, because that was really a kind of a special bonus for the women. So, yeah. So that's what the drop-in center looks like. if a woman that we've built a relationship with has decided they no longer want to be on the streets, they want help getting off, we have a client advocacy program that she can enter into through an assessment and some releases and agreements, and then we assist her in that process, and that can look different for each woman.
Yeah, for sure. Um, do you guys accept, just out of curiosity, do you guys accept any volunteers or any type of like donations or things like that?
We do accept donations. Right now, we are looking for winter coats for women only in all sizes. Boots, once the snow hits, we will be looking for boots or weather appropriate footwear.
Yeah.
Um, Hats, gloves, scarves, that sort of thing. And I think we're probably okay on sweaters. So our biggest need is the jackets. Last year, we had just enough to get through, so we didn't have any surplus to start the winter season off with. So right now, anything that comes in, it quickly goes right back out. So if they don't catch it at just the right time, they'll miss a jacket. Yeah. So we do take donations. We are accepting volunteers, and so there is on our website you can access a volunteer. It's the first page of our volunteer application, like a screening tool under Get Involved, and then there's a phone number to call to set up a time for like an interview or a meet and greet kind of thing. So we are accepting individuals as volunteers.
Okay.
Yeah.
And then that brings me up to my last question, which is any contact information. So how can we get in contact with Inner Beauty?
So there's a few ways you can get in touch with us through an email on contact through our webpage, which is innerbeautycenter.org. There are also our phone numbers are listed. The office number is listed on our Facebook page, which is the Inner Beauty Center. You can send an email to admin@innerbeautycenter.org as well.
Okay, perfect. And then lastly, do you have any other comments or anything that you'd want to share with us before we conclude this interview?
Well, I think one thing that is really important for community members to know is that when COVID started, we expected to see a decrease in the amount of women and the activity on the streets. We actually saw a significant increase in the number of women on the streets, which meant the increase of the number of buyers who were circulating the streets. And so there actually has been some documentation on that that activity there's documentation that it has increased and why. So there's a variety of different reasons, but so the other thing that has happened because of our increased street outreach is that we have had an increased number of women who have said, I really don't want to be out here. The truth is none of the women really want to be out there. None of them want to be doing this. It's just their journey in their life has taken them to this place. And so our goal is to build a friendship and then help them out. So we have had about maybe 8 to 10 women who have said, hey, please help me get out. So that's been an increase, and we're really excited about that. And so something that has really upset a lot of people's lives has actually worked as a positive influence for the women to be able to say, I'm done, so and that's the goal. If we can help any number of women, even just one, to get off the streets and reclaim her life, then we have done our job. So we continue to do that. So
well, thank you for that information. And then thank you for everything that you do for your service.
You're welcome. Right, thank you. So anybody can if they have questions, even if you feel like a family member might be involved in this and you have some questions about it, please feel free to either email or to call, and we'll get back to you on that, because we are supportive of family members as well in that situation. And sometimes we're actually able to to find the individual on the streets and be able to intervene if at all possible. So it's twofold, not just for the women, but also for potential victims and family members of that individual. So
For sure. Well, thank you so much for being here, and thank you for sharing about Inner Beauty.
you're welcome. All right. Thank you, Maria. Have a great day.
Thank you.
We definitely miss having Inner Beauty as our neighbor in our building where SOC is located. Inner Beauty is also located in the same building. But soon enough, we will be back. But thankful for that interview and for all of the orgs doing great work out there. And now let's have Marisol share our survey promo.
Has this live forum been informative and useful to you? What part of the forum could be improved or changed to make it better? Please take a quick survey that's located in the comments section so that we can keep 3 o'clock with SOC going for residents. Thank you for tuning in.
And again, any feedback into how you think we could change or adjust our format is super welcome. We want to know what you think. And there is in the survey, you can give that feedback. So let us know what you think and how we might change the format of this forum or how we present the information that would make most sense for you and benefit all of you by filling out that survey. And then with that, I just want to remind you all that tomorrow we're going to have Pedro Hernandez with us, who is an attorney at Legal Aid Society, who is going to talk about being represented if you are getting evicted. So I know that this is something affecting a lot of people. So hopefully, well, not hopefully, we know it will be really good information for folks to tune into. And then I just want to leave you all with a thank you video and a big thank you to Marlene for setting up this awesome forum today. And thank you to all of you for dealing with me another day on this forum. Have a great Friday and weekend, everyone.
Hello, SOC viewers. My name is Marlene Zaron, and I'm the SOC Forum Coordinator and the SOC COVID-19 Project Coordinator. We would like to thank everyone for supporting our 3 o'clock with SOC live show and for completing our SOC survey, in addition to thanking our residents for tuning in and sharing our show. We would like to also thank the following sponsors: Wisconsin Voices, Community Development Block Grants, Neo-Philanthropy State Infrastructure Fund, Movement Voter Project, Catholic Campaign for Human Development, Zilber Foundation, City of Milwaukee Office of Violence Prevention, Tides Foundation, Employ Milwaukee, and all the faithful individuals who support SOC through their personal donations. Thank you so much.